Macam mana kita nak
Hello and Assalamualaikum. My name is Wan Nur Shakina binti Wan Abaraza and my matrix number is 180661. And as for today, for our final SCL case study, it is about storage disease. Our topic for this case study is canine copper hepatotoxicosis. So what is exactly this storage disease? This canine copper hepatotoxicosis is an inherited disease in which abnormally high amounts of copper accumulated within the tissues of the liver, leading to cell damage and chronic inflammation. This chronic inflammation will lead to hepatitis. Ultimately, this will result in liver failure due to scarring, or also known as cirrhosis, of the liver and to death. This condition may be secondary or to a primary disease or the result of genetic-based abnormal copper metabolism. There are several common breeds. There are several dog breeds that are exposed to this type of disease, such as Bedlington Terriers, Doberman Pinschers, and also Dalmatians. In the case of Doberman Pinschers, copper storage hepatopathy is more prevalent in females and males. The disease is divided into three categories. First, the subclinical disease is when the disease is affecting the dog and is in the organ of the body of the dog, but there are no symptoms or changes in the dog's behavior. Secondly is the sudden acute disease. This form more often than not will affect young canines. It is associated with hepatic necrosis that causes the death of the liver and eventually the dog. Lastly, the chronic progressive disease. The symptoms of these are most often seen in middle-aged dogs with severe hepatitis. The dog may also have cirrhosis. Conversely, the secondary copper hepatopathy will only be shown with progressive signs of liver damage, usually because of chronic hepatitis or worsening cirrhosis. Copper storage disease in dogs can occur in any dog at any time. However, there are some breeds that seem to have a much higher probability of developing these potential killers. And I think that is all from me. Thank you very much.
Assalamualaikum and good morning. My name is Nur Zulaika binti Norizan, matric number 179013. And for today, I will describe about the disease that always occur in Bedlington Terrier. Okay. In veterinary medicine, copper-associated hepatopathy was first described in Bedlington Terriers in 1979. Since then, this breed-specific autosomal recessive inherited disease has been well characterized, and affected individuals are known to have inadequate biliary excretion of copper because of a gene deletion. This gene encodes a small cytosolic protein termed MER1 that is required for the final process of this vascular copper movement and excretion at the canalicular membrane of hepatocytes. Affected Bedlington Terriers can now be identified by genetic tests, which is the CT marker, CT deletion, or VETGen. Copper storage disease in the dogs will show an entire litany of symptoms. In the acute form of this disease, the first symptom is anemia. This will be very easy to spot, as several parts of the dog's body will become pale because of low red blood cell counts. This will include their gums as well as any other moist membranes. The dog may also start to exhibit dark urine as the result of bilirubin. Bilirubin is the breakdown of heme that is found in the hemoglobin of the dog's blood, and it is excreted in their bile and urine. In this stage, the dog will also start to develop jaundice, which causes a yellowish tint in the dog's skin and muscle membranes. In the chronic progressive stage, there are different symptoms to watch for. The first is usually an abdominal distension as a result of fluids building up, as well as all the same symptoms of anemia. In this stage, your dog will also become extremely thirsty, and as a result, will start to urinate frequently as their liver is basically starving blood. Okay, that's it for liver disease in Bedlington Terrier. Thank you.
Good morning, my name is Chong Chirni with metric card number 179106. Today I'll be doing a continuation on storage disease which is known as canine copper hepatotoxicosis, which occurs in a breed called Doberman Pincius breed. Chronic hepatitis in Doberman Pincius, also known as Doberman hepatitis, is whereby it's a disorder associated with histological features of chronic active hepatitis, cholestasis, and cirrhosis. This disease is usually diagnosed in middle-aged female dogs, meaning it usually occurs in female Doberman more than male Doberman. The high incidence of chronic hepatitis in Doberman Pincius compared with some other breeds suggests this disease is actually hereditary, meaning it inherits from generation to another generation. The pathogenesis of this chronic disease in Doberman has been debated for several years, and this disease may be immune mediated. Most affected dogs have chronic hepatitis and high liver copper concentrations, but the role of the high copper concentration is still unclear. Whether the increased copper concentration is the result of confluent cholestasis or whether the liver disease is a result of copper toxicosis is yet to be determined. Hepatic copper accumulation can result from an increased uptake, a primary defect in hepatic copper metabolism, accumulation can result a primary defect in hepatic copper metabolism or altered biliary copper excretion. The average canine copper liver with concentration is actually from 200 to 400 ppm per dry weight liver. For this breed, especially, there are specialized clinical signs for Doberman. So the initial clinical signs are usually subtle and intimate and can be gained as a calmer demeanor and loss of appetite. Gradually, the signs became more evident and can include salivation, nausea, intermittent vomiting, in advanced stages, polyuria, polydipsia, icterus, diarrhea, ectasis, and signs of hepatic encephalopathy may also be present. The projection of clinical signs is variable, but it usually covers over months. That's all I need for Doberman breed. Thank you.
3.
Good morning. My name is Daruni, anak perempuan Elmin. My metric number is 178977. So today I would like to present about the diagnostic and treatment for the copper storage disease. Okay. A complete blood profile will be conducted, including a chemical blood profile, a complete blood count, and urinalysis. A thorough history of the dog health must be given, including a history of its symptoms and possible incidents that might have precipitated this condition. The history that provided may give clues to whether the condition is primary or secondary origin.
A tissue sample will then be taken from the dog liver for laboratory analysis, biopsy, and ultrasound images will be taken of the abdominal area to examine the condition of the liver. Treatment of the dog will be determined by what type of disease the dog has, from acute to chronic hepatitis or liver damage and cirrhosis. The dog will be put on IV fluids and electrolyte supplements. In many cases, modifying the dog diet and providing it with dog food that is low in copper is an effective treatment. Most commercial dog food contain excessive amount of copper. Also, avoid giving a dog any supplement that has copper in it. Veterinarian can prescribe water-soluble vitamins for dog if needed. In rare cases, a surgical liver biopsy will be needed to screen the dog for copper storage hepatopathy. This also will make it possible for veterinarians to monitor the response of the dog to treatment. Dogs that have liver failure are at a higher risk of complication when put under anesthesia or surgery. That's all from me. Thank you.
Hi, my name is Intan Ain binti Sarwan. My meeting number is 179070. Okay, I would like to talk about causes of canine hepatotoxic disease. Okay, the causes is canine liver disease has a myriad of causes. Any number of traumas to a dog may result in liver disease. A hernia to the diaphragm, being hit by a car, a bus or heat stroke. A diet that's too high in fats can affect the liver. Females are more prone to this than males. A dog with chronic infections, in example, tooth problems, can contract liver disease. Fungal and bacterial infections can cause liver disease, as can parasites like heartworms and roundworms. Okay, contact with toxins from pesticides, herbicides, insecticides, bleach, household cleaners, and paint chips that may contain lead can all cause liver disease. Dog could contract hepatitis, which is an inflammation of the liver. Cancer can overwhelm a dog system or metastasize directly to the liver itself and lead to issues. Okay, I would like to move on to signs of the liver disease, which are jaundice is also a sign as a tint from yellow to orange will appear. It is most easily seen in the sclera of the eye, but is also variable in the gums and skin of an affected dog. More frequent urination, which may also distinguish between the main yellow and bright orange. Dog may be thirsty or have an unquenchable thirst. Their abdomen may look distended and be uncomfortable to the touch. They may have a lack of appetite, chronic weight loss, recurring gastrointestinal issues, or bloody vomiting. Their feces may be yellow or orange, a paler color than normal, or they may have bloody diarrhea with the above characteristic. Animals have strange behavior, circling, lethargy, no interest in playing or walks or accelerating depression. Their nervous system may also become affected in this stage, as it is unable to break down the ammonia that naturally accumulates. However, both of these forms may also show some other symptoms, bleeding from the gums and the nostrils, as well as severe diarrhea and vomiting. Okay, thank you.